Imagine a condition that progresses silently, without warning signs, and puts a significant portion of the population at risk for heart attacks. That's the reality of coronary artery disease, CAD, a condition that disproportionately affects Indians due to unique physiological traits like smaller coronary artery dimensions. But here's where it gets controversial. Even if you eat clean and exercise regularly, these habits might not be enough to shield you from hidden arterial blockages. So, how do you truly know if your arteries are in trouble? Let's dive into 4 non-invasive tests recommended by Dr. Jeremy London, a certified cardiovascular surgeon, to uncover the truth about your artery health and why these tests might just save your life. Number 1. Blood pressure monitoring. The silent killer unmasked. High blood pressure is often called a silent killer, and for good reason. It erodes artery walls over time, paving the way for fatty plaques to accumulate. Dr. London emphasizes that while lifestyle changes can help, only 12% of Indians manage to keep their blood pressure in check, according to the World Health Organization. The key takeaway? Regular checkups aren't optional. They're your first line of defense. But here's the twist. Even with controlled BP, other factors like visceral fat or abnormal cholesterol particles could still be at play. And this is the part most people miss. Blood pressure alone isn't the whole story. 2. Advanced blood panel, beyond cholesterol numbers. You've probably had a basic cholesterol test, but what if I told you that even with normal LDL levels, you could still be at risk? An advanced blood panel goes deeper, analyzing not just cholesterol and sugar, but also the type of cholesterol particles, inflammation markers, and clotting tendencies. Harvard researchers found that people with low cholesterol can still develop arterial blockages because of these hidden factors. Think of it as a detective mission for your bloodstream, uncovering clues like oxidized LDL or elevated C-reactive protein, which signal inflammation. This test isn't just about numbers, it's about understanding the quality of your blood's health. DEXA Scan, spotting the invisible fat, visceral fat, the stubborn fat around your organs, isn't just a weight problem. It's a ticking time bomb for your arteries. Dr. London likens it to an engine for inflammation, releasing proteins that damage the endothelium, the inner lining of arteries. A DEXA scan, typically used for bone density, can precisely measure this dangerous fat. Why does this matter? Studies show that visceral fat levels are a stronger predictor of heart disease than BMI alone. Imagine having a healthy BMI, but carrying a high-risk fat profile. This is the part most people ignore. And here's a thought-provoking question. If you've been told you're healthy, based on weight alone, are you truly in the clear? Core. VO2 Max Test, the ultimate longevity indicator. Athletes know the VO2 Max Test measures aerobic fitness, but cardiologists are now prescribing it to everyone. This test calculates how efficiently your body uses oxygen during exercise, a direct reflection of cardiovascular health. Dr. London calls it a powerful determinant of longevity, noting that low VO2 max scores correlate with early artery blockages. Even if you're not an athlete, this test reveals your heart's true capacity to deliver oxygen to tissues. But here's the kicker. Many people assume they're fit based on daily activity, but a VO2 test might tell a different story. Could this be the missing piece in your heart health puzzle? The bigger picture. Why these tests matter. Artery blockages often develop silently, and Indians face a double whammy of genetic and lifestyle risks. While the 4 tests above offer a proactive approach, they also spark important questions. For instance, should these tests be standard for everyone regardless of symptoms? Or do they over-medicalize a condition that's preventable through lifestyle changes alone? We'd love to hear your thoughts in the comments. Have you or someone you know used these tests to detect hidden risks? Do you think they're worth the cost? Or are they just another tool in the paranoid health toolkit? Let's keep the conversation going. Your insights could help someone else avoid a life-threatening surprise.